Most of you know I've been giving extensive coverage in regards to this Ebola situation. We know that they're flying patients infected with the deadly Ebola virus from Africa back to the United States, to Atlanta, to Emory Hospital. I've been giving you the best coverage on this, and I'll continue to do so. I'm very concerned about this. I think this is a huge mistake. I talk about why I believe that in many of my videos, and I give evidence in regards to that. This morning, Dr. Brantley arrived at Emory Hospital in Atlanta. I'm about to show you some more video footage of that. I've already shown you video footage earlier when the news story of this first broke. This is a little bit more up close video footage here, and there's a reason I want you to see this. They have him arrive in the ambulance, and then he walks out of the ambulance into the hospital. Now that looks good. I'm sure obviously they planned this because it looks like he's recovering. And I certainly hope he gets better and is doing better. But the fact is that Ebola kills between 60 and 90% of the people that it infects. In other words, the death rate of it is 60 to 90% chance that you're going to die if you get it. So that's very high. So anyway, I'm about to show you this video, and I'm already concerned. I created a video last night with a few new ideas in regards to things they can implement to the plan with this hospital in Atlanta to prevent this virus from escaping the room where these patients will be. And that's of utmost importance to keep you and I safe, your family, friends, everyone in America safe. This is just a huge risk they've taken, but I'm already seeing problems. They get him out of the ambulance, which obviously looks good. They planned this, but the problem with that is they have him walking in this suit. These are the protective suits. They're made to prevent the virus from getting outside of the suit and endangering anybody in the hospital or general public, Atlanta, anywhere. And by getting him out of this ambulance and having him walk ambulatory, walk into the hospital, I have a big problem with that. And I don't mean to be picky, but one mistake could cost hundreds, thousands, maybe even millions of people their lives if this deadly virus gets out in the United States, because we know it's out of control like wildfire in Western Africa. They can't control it. And the same thing's going to happen here if this virus gets outside of the hospital, outside of this room, outside the hospital, and somebody contracts it. It could be simple as a fly landing on some fluid that's from bodily fluid or blood from one of these patients, and then flies on an area where somebody touches something, rubs it to their face area. There's many ways it could happen. Any type of bodily fluid or blood gets outside of this area, could get on a body part of somebody else and touch it. And many people even believe, there's a Canadian study that shows that it's airborne. So the thing is, we want to keep it contained inside of these suits and in these special isolated hospital rooms. But by having this doctor walk out of the ambulance into the hospital, like I said, these suits are not designed to be walked on in cement where there's sharp objects. Now he's going to walk out of this ambulance on all this area here where you can see looks like rocks and sharp objects all over up in here, all kind of stuff that could penetrate. The body weight of a man's body weight is heavy, and it puts a lot of pressure and weight on the bottom area of where his feet are, the bottom part of the suit. And these suits simply aren't designed to be walking on sharp objects, and that's exactly what he does. He gets out of the ambulance, he walks on all these rock-looking sharp objects into the hospital. I'm very concerned about that, I really am. When I see mistakes like this made already before the patient even gets into the hospital, I have a big concern, a really big concern that something bad's going to happen. This is a very serious situation for everyone here in the United States. I hate to ask this, but if anybody knows anyone, my videos are getting a lot of views. I'm getting more views than anyone in regards to this news story because I'm most concerned about this. And so I'm giving you the most updated information, reaching a lot of people, getting a lot of comments. The comments that are coming in are in support of what I'm doing. Everyone in the United States, it seems, most everyone, over 99% of the people are very concerned about this and think this was a bad idea to bring these patients over here. We could have taken care of them good over in Africa. We could have provided everything they need over in Africa. There's nothing we can do. This There's no cure for this this virus. All you can do is comfort the patients, and we could have done that over in Africa. Why bring them over here and risk everybody's lives in the United States? Makes no sense. But let me get back to this. Anybody that knows somebody that works at this Emory Hospital in Atlanta, or anybody that works at the hospital that sees this video, please have someone that knows what they're doing get some sodium hypochlorite and spray this all in this area where this doctor walked from the ambulance into the hospital. Please do that, just as an extra precautionary measure. It won't hurt to do this. I think it would be a great idea. Please do this. You're going to have to, obviously, the people that are familiar with the hospital will know in this video by looking at it where the doctor walked out of the ambulance into the hospital, so they'll know where to spray the sodium hypochlorite. Thanks. Wow. I'll show you.
Learned it was the doctor himself, and as you can see, being helped, the back door gets closed to the ambulance, and he is led over to a side entrance here at the Emory University facility. Now, Dr. Mark Siegel, who works for our medical aid team, of course, he says that that is the case. If that is the doctor walking right there, it is a miraculous maneuver for him to be doing that. Take a listen also to what we heard from earlier today from Emory University Hospital.
We have an inordinate amount of safety associated with the care of this patient, and we do not believe that any healthcare worker, any other patient, or any visitor to our facility is in any way at risk of acquiring this infection.